good afternoon, everyone. Good evening for someone, good afternoon for someone else. I'm Dr. Carmelo Crisafulli. I'm a specialist plastic surgeon with Italian board certification, working in Dubai since 10 years almost. Welcome everyone to the Bioscience webinar IMCAS. I believe that after the success we had in IMCAS, we decided to dive more into the correction of asymmetry with HA filler. So Bioscience has organized this session with some of the best international trainers and experts. I'm one of them. We will have our beautiful Dr. Piero Crabai, Dr. Brambilla, and we will talk about the asymmetry of the different districts of the body, face, calves, myself, and buttocks, Dr. Crabai. A small introduction about the company. Bioscience is a German laboratory that has been pioneering the field of aesthetic medicine since 2001, and particularly driven to ensure the highest standard of patient safety, scientific excellence, using the best HA market for body contouring and face contouring, which holds the CE certification since 2014. In today's session, hear first from Dr. Massimiliano Brambilla, Italian board plastic surgeon, who will talk about the experience using HYAcorp for face deformity and asymmetries. Then I will be talking about Calves asymmetry with HA filler. And then last but not least, we have Dr. Piero Crabai, another Italian plastic surgeon, and he will talk about the correction of buttocks deformities. So before we start, if you have any question during the webinar, please type them in the question box at the bottom of your screen. And then at the end of the session, we will answer to some of the questions. If we will not have time to answer to your question, no worries, you will receive an answer by your email. So I will begin the session today with Dr. Brambilla. Ciao, doctor, how are you? Dr. Brambilla, are you
Hi,
with
Carmelo,
us?
can you hear me?
Yes, nice to see you again, my dear. All good?
The same for me. Everything is fine, despite the weather in Milano that is raining right now. I wonder if there in Dubai, the weather is much nicer.
So thank you again for joining us today. Please, the screen is all yours. Enjoy.
Thank you. So let's go to the screen. First of all, thank you for the invitation to be here. Okay, so let's go. So my talk today would be about the use of hyaluronic acid in asymmetries and deformities of a face. Is there a rule for HA in those cases? And I will go sharing with you an experience on one case that for me is quite emblematic of what we are talking about. So case discussion, trauma and post-surgical with HA remodeling. The general consideration is that some individuals experience some facial traumas or scars or deformities, but they refuse to have secondary surgeries because they are not prepared to that. They had many surgeries before and they say, stop, I don't want to go further with major invasive procedures. Can we do something? So is there a rule for HA? And which are the benefits, and more than that, are there limits in the use of hyaluronic acid? So we'll go with one case. This is a case of a patient of 38 years old, 38 years of age. She had left forward 2 because she had an hypoplasia of the maxilla, and then she had even a nasal trauma. She had previous surgeries, important surgeries that took months to heal, and she would like to improve her face, but she don't want to have any more surgery. So what we can see here, we can see that in the 3/4, what she has are some hypoplasia of the temple. She has an hypoplasia, still little hypoplasia of the maxilla. She has nasojugal folds. She doesn't have much chin. And what we can do, we see here that she has even a hump on the nose, but we know that hyaluronic acid, especially HYAcorp, is not. We may do it, of course, in the nose, but is not written that is not one of the indications, so we will not talk about that. As a surgeon, The first proposition was of full face lipofilling and malar implants, a rhinoplasty. But she said, no, doctor, for me, it was fair enough to have my experience before. So I want to stop. I want to have something that is much lighter. I want to have a fast recovery. I don't want to have surgeries. And so the aesthetic preferences by priority were an overall face improvement. And the other thing that we have to point out and to understand is even the economical factor, because if we inject 1 vial, 1 ml of hyaluronic acid is one price, but if we play with multiple vials and multiple cc's is much more expensive. And so we have to discuss about this fact with the patient. And so the patient, lucky for her and to me, she didn't have any economical regrets, and not regrets, but she had no economical problems, and she just wanted to have a benefit. So which is the goal of the procedure? My goal here is to enlarge the diameters. So you see here that I want to enlarge the temple. I want to highlight better the eyebrow in the lateral portion. I want to highlight and increase the cheeks. I want to decrease the nasolabial folds and the marionette as well. So what I planned in this case was a combination of HA, some botulinum toxin for the forehead. In the malal area, I will go in first stage and 2 stages. The first stage, I will go with HYAcorp face in the malal area, in the temple, eyebrows, and in the nasojugal folds, while in the lips, I will use lips. Then in my plan, I want to wait 1 month in order to stabilize everything, and then going back to the cheek and to the malal area for some mild correction. I think that 1 month is enough to stabilize the result with such amount of hyaluronic acid. You see here my plan. I will use cannulas, 27 gauge cannulas and 30 gauge needle for the lips, short needle, and then for the correction of the nose, I will use some 30 gauge needle as well, but we will not talk about that. So some details about HYAcorp lip. HYAcorp lip is hyaluronic acid, is indicated for lip contouring, for lip augmentation or restoration of the volume. It's a biphasic hyaluronic acid that comes in syringes with 1 ml. And one of the main characteristics of lips is that it's very soft and malleable. It means that you inject it and then you can squeeze a little bit and it will spread very, very easily. So it's super soft. Non-cross-linked, HA, and the particles are 80, 150. So it means that are very small particles and can be very easily injected with 30 gauge needle. Face is indicated for deep augmentation, for cheek, for the jawline, for the nasolabial folds, for the glabellar folds, and for the chin reshaping. And it comes in syringes of 2 ml, 2 syringes of 2 ml. And it's very long lasting and it lasts more than 12 months. I had cases where I can demonstrate it that the result lasted even more. It's biphasic, and so the indication is to improve the facial contours and to restore the loss of the volumes. Non-cross-linked HA plus cross-linked HA. You see here the particle size 80, 150. And again, one of the characteristics that is quite soft and malleable, but of course is not as soft as malleable of lips, because the virological properties are very different from lips. I strongly believe in virological characteristics, so you cannot interchange one product with the other. Don't use a face for the lips, even if you think that it can be better to highlight and to have big volumes, because you may be, and the patient may be dissatisfied with the result, because there is no indication for lips, but it's wonderful if you want to achieve a better contouring of the face. So how I treat the patient, I start first of all with injection into the entry point. I hate pain because I want for my patients to have a good experience. I want them to come back with a good experience in their mind. So I always start with a small injection. And even the lips, you see here what I do. I always start first of all with some anesthetic cream on the lips, then few drops of anesthetic into the lips in order not to have the sensation of the bruising when you inject it. When I'm asked about the combination of hyaluronic acid plus anesthetic, I always say that if you tried on yourself the injection even of a product with anesthetic into the lips, what you feel is the immediate bruising, is not what happened after. The bruising goes away very fastly, is the first moment, the first 1 second. So if you cancel this problem with some anesthetic before, you can get much better result. So you see here that then I start to inject with a small 30 gauge needle in order to enhance the volume of the lip, starting from the inside the mucosa, in order to make the mucosa going out. Where are we injecting the hyaluronic acid? You see here a cadaver dissection. You see inferiorly the muscles, and when you inject the hyaluronic acid, I would like to say that we are always injecting right under the mucosa, but even if you're injecting with a small needle, in some cases we are injecting into the muscle, but this is not a problem. But I really believe that a short needle, 30 gauge needle, may help a lot to be as much superficial as possible. Then when I ended with the lips, I go with the face into the temple. I enter with, there is the entry point with a 27 gauge needle. Then I go with a 27 gauge cannula, and I'm between the two fascias that I will show in a minute. You see that I'm inside in the right plane of the fascia. And where are we injecting here? You see from that cadaver dissection that I'm injecting between the deep and the superficial fascia. You know exactly, we know that we can go even deeply, but I think that in the majority of the cases, we may inject in this plane, and this is a wonderful place to inject. Then I go on the lateral eyebrow in the injection of the roof. So I move the cannula from the temple to the roof. Here you can see very nicely the roof. Here you have to be precise. More precise you are, and better the result that you can highlight. Then after we finished with the temple, from the same entry point, I just turn the cannula inferiorly, and I enter inside the malar area with a 27 gauge cannula, injecting in lines in the deep surface. 3-4 lines of product are fair enough to achieve the result that we want to achieve. Injection, where are we injecting? In this case, we are injecting inside the roof, because in this case, I want it to be there. I want it to be inside the roof. Then I move to the nasojugal fold. I change the needle, and I go with a 30 gauge needle instead of the cannula, because I want to be superficial. I want to be right in the deep dermis, and with the cannula, you cannot be in the deep dermis. You always are right little under that. And if you have a nasojugal fold with a deep wrinkle, you have to correct the deeper surface, and then you have to correct even the more superficial one. And here you see the result after 1 month after following my injection. You see that the diameters are better, and the diameters, the horizontal diameter is enlarged. The temple is corrected. The zygomas are corrected, and the nasojugal folds as well. And the lips, of course, are better than before. You see here from the lateral point of view, and patient was happy, but we had a second correction, a second step. And where I wanted to inject in this case, in this phase, I wanted to inject the cheek, because I felt that she needed better volume into the cheek. So the entry point is the same entry point that more or less the same entry point that you have seen in the first one. And I'm under the dermis. I would say that I stay with 3-4 millimeter under the dermis, and I'm over this mass, and I'm injecting with a fan technique. More or less with a technique that we use, for example, with a nanofat in order to enhance the soft tissues. So I'm going in and out with multiple injection, multiple lines, multiple injections, small volumes. It's crucial to understand the fat compartments. And as I told you, where I'm injecting here, I'm injecting mainly over this mass. You see here, I'm going back to my cadaver dissection. You see this mass, and I'm right in the plane in between the fat under the skin and this mass. You see here the pre-treatment and after 1 month, and then following some months after the treatment. And I think that the result is a very good result. The patient was very happy. The 2 treatments took no more than 10 minutes to be done, and so the satisfaction was very good, both for me and for her, without any surgery. You see here from the frontal view, the lips are better, nasojugal folds are better, cheeks, temples, and eyebrows have been nicely corrected. There are some questions about what we do with HA, and those are the questions that I want to share with you and to my panelists and to everyone that is hearing us. First of all, are there any other non-surgical options to correct such a case? Then the second question that I would like to ask to everyone is the second stage procedure planned correctly after 1 month, or would you wait less or more? And then third, last but not least, is the injection of around 10 ml of HA during those sessions biologically excessive, or are they not excessive? Are we safe injecting such volumes, or are we not safe injecting those volumes? I will leave those questions open to the panelists and to all of you to make a discussion about that. And I thank you for the attention, and I give the screen back to Dr. Crisafulli.
Thank you very much, Dr. Brambilla. Impressive result. As always, you are a master in these things. Thank you very much. So now it's my turn. I'm going to talk about the calves rejuvenation and calves asymmetry correction. So let's talk about the correction of the calves. First of all, again, I'm Dr. Carmelo. I'm an Italian plastic surgeon based in Dubai, and let's see how we can correct the calves asymmetry with hyaluronic acid. Before starting talking about the hyaluronic acid, of course, we know that there are many other ways to do the correction of the calves. First of all, surgical correction is what in the last decades, I would say, it's taking ground in the plastic surgery field. But still, the patient, they are a bit, afraid of going through a surgeries. They are quite afraid about the outcome of the surgery. So whenever there is a small asymmetry, or whenever there is a small calf and the patient doesn't want to have a procedure, surgical procedure, we can do a surgical augmentation with hyaluronic acid. So in terms of surgery, we have the opportunity to put the implants superficial, submuscular, or do, again, fat grafting. But once again, because the patient is afraid about the complications like seroma, like displacement of the calf implants, or because also the fat grafting at the end get absorbed by about 30–40% in the next month, hyaluronic acid is still a solution that can be done in our clinic without harming too much the patient. We always talk about certified hyaluronic acid. We are talking about bioscience product. In the specific, we will talk about HYAcorp MLF1. And the most important thing is the proper injection technique. I will try to run a video later in order to show you my own technique. And regarding the particle size, whenever we use a dermal filler for body augmentation, for body treatment, we need larger particle size. So in this case, HYAcorp MLF1 has a particle which goes between 200 and 350 micron. MLF2 is reaching 500, but for the calves, it's always better to use the MLF1. And in this case, whenever we use small particles, they expose more surface to and less volume. So at the end, the absorption is going to be faster, while the larger particles, talking always about biphasic filler, are more resistant to the volume. Anatomy of the calves, quite easy. In terms of vascularization, we got to be careful about the popliteal vein and popliteal artery, which are exactly in the middle of the popliteal groove. I don't know if you can see my arrow. And so whenever we're going to work on the enhancement of the calves, we work basically on the enhancement of the medial and lateral shaft of the gastrocnemius. We have to be careful when we work on the lateral shaft because there is a superficial branch of the sciatic nerve, which if it's traumatized too much can give the patient the back pain likewise, which is not nice for the patient, of course. We work always posterior, lateral, posterior, medial. We never go on the frontal part of the leg, of course, because we have other structure like the saphenous vein and like the saphenous nerve we don't want to touch. Injection has to be done, of course, on the top of the muscle. We had a nice presentation with Dr. Brambilla and IMCAS, and we were seeing that despite we try to inject as much we can on the top of the muscle, sometimes we can still go under the fascia. There is a particular technique of injection which is quite easy. Instead of going vertical with the needle for the entry point, we go obliquous in order to be sure that we don't go over the muscle. I will show you now with the video. So entry point, we do two entry points, one for the lateral shaft, one for the medial shaft. On tall patient with a long leg, let's say, it's also possible to to create another entry point on the lower third of the leg, always paying attention to the vascularization. Whenever we have patient with varicose vein or with vascular problem, these are not good candidates for the calf augmentation with hyaluronic acid.
The plane for the injection with the cannula. I'm doing the local anesthesia, okay? You will have a small pinch here, okay? Just relax. 1, 2, 3, that's it. You will burn a bit. Okay. So I disinfected the area. I did the local anesthesia. I create now the entry hole with 18 gauge needle. I pinch the area and I go just slight obliquous with the needle. 1, 2, 3. Perfect. The patient doesn't feel anything because there is anesthesia. Don't rotate or tilt the needle. So don't do this or don't do this because having a triangular shape, in this way we can cut the dermis and create a small scar. Thank you. Can I have another gauze, please, with the disinfectant? So now, to facilitate my life, with the gauze with chlorhexidine, I take our cannula, 18 gauge cannula per 10 centimeter, and I bend it a bit, like this, in order to have an easy injection. I enter my area and I start my injection. If you feel anything, just tell me, okay? So I'm on the top of the muscle, of course, and there you are. You can see that the cannula is here. We are not deep, we are not superficial, we are in the right layer. And I start my injection with the retrograde technique. The patient might feel a bit of burning feeling right now. I'm using MLF1, I know. Nice and gentle movement. If there is any obstacle, I don't push too much. Sorry. Always create some space while you're doing the injection, so the filler will not leave any lump. This patient, I'm planning, very honestly, 1 syringe per this side, maybe 1.5, in order to compensate the asymmetry. Now I give some volume a bit more posteriorly to make it more even. Can I have a stereo close, please? And I finish the syringe. I clean the area. I keep pressing here. And now you can see already there is more projection on this part, but still the skin is not completely even, so I have to massage. And massaging the area would be a bit annoying. Was it painful? Huh? But I mean, it's not too much, right?
Yes.
Good. Now the massage is a bit annoying, I know.
Patient has a not developed muscle, or there is a congenital small calves or no responsive to excessive target. What the patient are asking, mainly the women, of course, is to have the same shape of the high heels calves. So with the definition of the muscular shaft without wearing the high heels. Regarding the men, they usually ask a volume improvement of the medial and lateral shaft, like they develop the muscle at the gym. So we use MLF1, each syringe is a 10 ml, the lasting is up to 24 months. It is a biphasic high particle size, and it can be used for correction, augmentation, and of course, giving a filling effect. The MLF1 can be used also for hands rejuvenation, for concave deformities correction, but in this case, we use for the calves. It is a cross-linked HA with 20 milligram concentration. Injection is done into the hypodermis, so we are talking about fat tissue. Particle size is between 200 and 350 micron. And for the injection, I usually use a 20 gauge needle, cannula, sorry, for the calves. But even the 18 gauge gives a nice effect, because at the end it's quite easier for the injection with 18 gauge. This is something very important. We want something which is elastic, something which is firm on the same time and keeps the result in the long term. And also it's important, mainly when we use a filler on the legs, we want to reduce the swelling factor. We don't want to have high swelling because we don't want to have complication because of that. Here is some example. This is a patient who had an asymmetry between the two legs. I injected in total 3 syringes of MLF1, 2 on the right side and 1 on the left side. Front view, you can see already the symmetry correction. From the back side, before she had the medial shaft pretty straight, and at the end of the session was a nice curve like she trained the calves. Straight legs, here we don't talk about the symmetry, but we talk about a patient who didn't have shape of the calves. So I injected a total of 6 syringes, 1.5 each shaft, so 3 syringes on the left side and 3 syringes on the right side. These are immediate after result, and in this way you see how I emphasize the shape of the calves. This is the patient I showed you before. This is the asymmetry share, so the lower shaft, the left medial shaft, it's quite bigger than the right one. With the injection of the filler, I make the volume, the same volume on both sides, giving more curve on the shaft of the right leg. Front view, the right one was straight, and now there is a curve which is correct, which has been corrected. And this is while the patient is again in a standing position with the lifting on her toes. So you see the definition of the calves. It's similar, and the asymmetry has been corrected. When we do not inject, when we have vascular disease, patient with uncontrolled diabetes, because patients with uncontrolled diabetes unfortunately are prone to infection and have complication on the healing or eventually any wounds, skin infectious disease, and of course previous treatment with permanent filler. Regarding the complications are the same of all the other fillers, because any complication we can have on the face, we can have on the buttocks, on the body in general. It's really important the way we do the injection. I've always say during my training, whenever the patient has an infection, has a granuloma, or has a migration of the filler, it's not a problem of the product. It's a problem of the injection, of what we did, because the infection most of the time is taken into our clinic. Granuloma happens because we injected big bolus of filler, sometimes in the wrong layer, and the same like migration. And so it's a wrong technique of injection. Nodules can be easily fixed with just a massage. Necrosis, I hope we'll never get any necrosis, but still on the legs, we gotta be careful. We cannot overcorrect. We cannot inject too much filler, because then we might risk also the compartmental syndrome. Why? Because being a tubular structure, if we add a lot of pressure on one side, we create a lot of swelling, and so also the other structure, also the other tissues can suffer. Whenever we have a complication like granuloma, like nodules, what I do usually is to give a therapy of anti-inflammatory, sometimes with steroids, sometimes not, depends patient by patient. And if the inflammation is still there, if I can still feel some nodules, I use my ultrasound and dissolve the filler. But most of the time, the patient have an immediate, they go immediately back to their own life, they don't have any kind of complication, and they are happy with the result. Saying that, I finish my presentation. Still, if there is any question, if there is any query, please write down in the box. And now I give the word on the screen to Dr. Piero Crabai, which will talk to us about the correction of the buttocks deformity and asymmetry. Ciao Piero, come stai? How are you?
Hi, very good, very good. I'm talking from Dubai. I'm Dr. Piero Crabai, plastic surgery specialist. I'm working in Milano and Dubai. I'm sharing my time in between those two cities since 10 years. And so I'm a trainer of bioscience and HYAcorp since 2014. And today I talk about something that is more reconstruction, connected with the reconstruction than for the beauty. So we are talking about gluteal deformities and treatment with hyaluronic acid fillers. Okay. I cannot have a control. Okay, sorry. Well, so basically we have 4 variables in a buttock shape that are depending first from the bony framework of the patient, from muscle and nerve affection, and from fat variation and skin condition. The bony framework deformities are belonging to lower limb affection and bones and joint. It happens when you have a scoliosis that is very evident, or when we have a pelvic affection coming from trauma, inflammatory affection, and from other pathologies. Obviously, we have to study all the bony structure of deformities of the lower limb and the upper limb, and we have to check the lower limb asymmetries, the scoliosis, even the joint affection of the knees and of ankles, and of the and other problems that are coming from bony infection can affect the symmetry of the pelvis and of the buttocks as well. It's very important to examine the patient when you're coming in your office and your clinic and from all the sides. And so we usually do a postural examination of the patient when she's asking to have a correction of the asymmetry of the buttock. I do this kind of examination that is a full examination of the body. The other problem that is happening as muscle and nerve affection, this is very difficult to sometimes to correct, and coming from muscle hypertrophy, from neurological affection, trauma, disc herniation, or from immunological disease, that multiple sclerosis or other like Duchenne, and that's very difficult to treat with in any case, and to have a reach satisfactory result. The other one that is possible to treat are deformities that are coming from fat and age. So the one that are coming from excess of fat, from extreme weight loss, from age-related fat distribution, or low elasticity of the skin, and muscle hypertrophy, or related with age. It's important to know that fat skin deformities are possible to treat with macromolecular hyaluronic acid when the patient requirements are good, and when indication is the right one, and your skill can give the patient and to you the chance of get an acceptable result. Obviously, we have always to start from the study of the anatomy, and to specifically we have to examine the level of increased leg, the intergluteal cleft, the gluteal fold, and the hip region with the greater trochanter extrusion. So in case of deformities, the treatment should be customized, evaluating the amount of filler, and at the same time we have to evaluate even the skin quality to use exactly the better filler that we can use related to the G prime. This is to restore the possible asymmetry. So what is how we can work with G prime, how we can work with optimizing the rheology profile? So we have the possibility with to understand why we understand the we have experience, we understand the quality of tissue, to use different molecular weight in the tissue, and with the different particle size. And we have even the possibility to use the different hyaluronic acid concentration. This is possible with the HYAcorp and the bioscience product, in which LF1 is the one more indicated for superficial injection, and the other one, MLF2, for more deep injection. The first one is giving more smoothing the superficial tissue. The second one is giving more projection and more volumization on the structure, a deep structure. Obviously, we have, this is the description of the two products, or both of them are not we are cross-linked and biphasic product. The concentration is always the same. What is changing is the changing the rheology. is the particle size, has been well described from Carmelo and from Dr. Brambilla as well. So excess of weight gain implication, as you see in the patient, are coming from the ptosis of the gluteal area, from increase of the height and the width of the buttock, from the lengthening of intergluteal crease and the shortening of intergluteal fold. You see the lengthening and the shortening of the gluteal fold. Now I show in some cases, this case is the first case of a patient that gained weight during the time, and she came to my observation that she wants to resolve the problem of the asymmetry. As you have seen here, we had an increasing of the fat on the lower part of the buttock. I resolved this problem injecting the upper part of the buttock with MLF2 and giving more projection on the middle part. In this case, I reduced the lengthening of the intergluteal fold and I reduced the lengthening of the subgluteal folds, giving a better shape, even in a patient that has been subject to increasing of the weight. When we have the fat reduction is more difficult because we have a ptosis of the gluteal area. We have increased the buttock height. We are lengthening even of the gluteal fold and intergluteal crease, and increasing of laxity and cellulite. In this case, we have to examine and we have to understand if we have any contraindication of injection of the part, and we have to even to tell the patient that it's not possible to do. So this is come from your experience and from the knowledge of the anatomy of the part. In this case, the second case came on my observation, this patient that she had weight loss, and as you have seen, as it's possible to see, she had a loose lateral medial part of the buttock, and she had the appearance of the folds in the upper part of the gluteal area and the mid part. What I did is simply to enhance the upper part, and so elevating and giving more projection to the upper lateral part and to the medial part. In this way, I reach an acceptable result, even because I injected the lateral part, reducing the folds that is appearing from the loose skin. Then this is even very difficult to treat at the age related to the skin elasticity implication. So we have usually an atrophy of the skin and muscle. We have a ptosis of the gluteal area. We have lengthening of the buttock, as you've seen, lengthening of the intergluteal and infragluteal crease. As more often we have the cellulite. This is a case that has been treated during the time, because all of this case, it's better to treat several times instead of treating, expecting to have a good result in one time. And this is the patient during the time. The patient gained a little more weight, and this is after several months of treatment with the MLF1 on the surface and MLF2 to give more projection. I always give projection to the upper part, and then I try to give more shape on the medial part. So the last picture of this patient, it has been this one with the complete recovery of the deformity. Then we have the acquired deformity. Acquired deformity are coming for surgical deformity, for infection of permanent filler, wherever happening that the patient is coming, or uneven treatments. Uneven treatments that even because of liposuction, or uneven treatments to remove the permanent filler. We have this case. I show this case, a patient 32 years, a Caucasian, that has been treated with permanent filler in the buttock, and so she wants to do a treatment of liposuction and J-plasma in another place. And this is where the appearance of the patient with a very reduction of the subcutaneous tissue coming from this this treatment, and she had even infection of the area coming from the spreading of the infection, infection that was inside the body because of the permanent filler. So after 6 months of this treatment and antibiotic and hospital came and my observation, and there were not possibility of any fat transfer. So I started treating during the time and to try to give a better shape. As you can see, even in the other case, you see how the hyaluronic acid is giving even a better appearance of the skin, is nourish the skin and the surface of the skin. And you see how it is improving. So after I arrive on negative permanent filler, I treated with MLF1 and MLF2. Then this is the possibility a patient wants to have more projection. It wasn't possible to achieve with the hyaluronic acid. So I treated the patient with a buttock implant. And this is to show how it's possible to get a nice result with the two filler combination with the two fillers and surgical treatment. And you can see how even the skin has been recovered as much as possible. That was possible. And this is immediately after the buttock augmentation. This is another technical kind of patient. Is an African patient of 45 years. She had a liposuction. She came observation to have not surgical correction. The patient has been treated MLF1 superficially to reduce the superficial fat scarring, and MLF2 to enlarge the buttock and the volume. So we reach the volume that she was desired, that was as she desired for an ethnical sense of beauty. And we give more, I give more shape and I give more roundness to the buttock. This is another patient that had been treated from, so had been injected with a polymethacrylate, and then when a very severe infection, it has been treated and drained the patient and put on an antibiotic therapy. I removed surgical the remaining product, and it has been treated in a hospital to remove the rest of the product that was inside. So in this patient has been, this is the result after the two treatment, and the patient that has been now had this deformity one side and the other, but completely healed. So in this case, I injected both the areas, the touching and trying to improve the superficial thick and superficial fat whenever it was possible, and giving more projection with the two different products, MLF2 in deep tissue and MLF1 in the surface. This is another patient. This is to show how the scoliosis can even condition the shape of the buttock. She's an African girl, and she had a fat transfer, complete fat transfer. She was not possible to treat any other case than with hyaluronic acid. Unfortunately, the length of the lower limb was different, and she had a big scoliosis. And always I treated the patient superficial MLF2, and I reached exactly the shape as she want. Obviously, it's a huge shape, but from her ethnical sense of beauty, she reached the result that was requiring. And this is the last last treatment that I did in last edition of IMCAS, and that has been showing how much we improved the volume in this asymmetrical buttock with the QuantiCare. And it's very interesting to see how it's possible to inject differently in one side and the other. So basically, these are the two pictures that I want to show. So indefinitely, the hyaluronic acid is a safe product. It's to restore the volume in the lateral stanza. HYAcorp with two formulation give the possibility to the practitioner to restore volume not only for aesthetic purposes, but even for tissue reconstruction. The operator experience and knowledge of pathological process can reach a remarkable result with our macromolecular hyaluronic acid of bioscience. Thank you so much. I hope to be in time for your question.
Thank you very much, Piero. Thank you very much. Nice result. I would like to start, if you're here with us, keep the mic on 1 second. So we heat the iron till it's hot. Let's start with some question and answer. And, you know, one of the common questions that I received now in the panel is how much max we can inject? How many ml of filler we can inject maximum for the buttocks? Please, can you answer?
Me? Okay.
Yep.
Yeah, basically, I'm not exceed of 150 ml. Even today, I did an injection like that, 150 ml in any session. I usually do several sessions. I can even reach a high amount, but always I'm checking how is the result, how is the even the patient acceptance of the product, and I usually do the scanner to check if I have any migration, and this is why I'm getting this kind of result, because I'm injecting, of course, a number of and a huge amount in these cases of reconstruction, but always checking. Yeah.
Okay, and one more question for you, if you don't mind. Someone asked, what should the patient consider for choosing the right practitioner for correction of asymmetry with HI filler? You mentioned about the practice, the way of the injection. So please, can you tell us your feedback about the injection way, not to overcorrect, being careful to the anatomy?
Of course, I try not to overcorrect. Usually, I use a retrograde injection of the product. I start using from the deep tissue and to superficial tissue. Obviously, in the case that I shown, it was very difficult in several cases to find the manually and to have a feeling of deep tissue and superficial tissue. So before I start with MLF1 superficially, and then especially in the scarring tissue with a very low amount. And then after I check, and when I see that the quality of the skin and the thickness is increasing, I go on injecting, unless I have a good result and I feel that the tissue are elasticity can even hold this amount of filler.
So at the end of the experience of the surgeon, of the practitioner, is at the base of everything, because as you can see, you are talking about many conditions that maybe someone who is starting using now HA to correct asymmetry didn't face before. So to answer to the question from the audience, yes, for sure, the technique and the experience of the practitioner is at the base of having a good result.
Obviously.
Thank you very much, Piero. Max, some questions for you. Actually, you got the more number of questions, the higher number of questions. So starting with the one, which is, are there specific areas of the face where HA fillers are more effective in correcting asymmetries?
The answer, it depends on the asymmetry. I would say that every time that there is a bony structure to correct, you can achieve a very good result, because deeper you go, better the result. More on the surface and more difficult is the effect to achieve a good result, because it's even a matter of safety. If you have more soft tissue that covers well the product that you're injecting, and the better the result. So is it a good answer?
Yeah, it's a good answer, and I connect to another question, because someone asked why not to use calcium filler, calcium hydroxyapatite, whenever you to enhance the bony area.
Yeah, well, I think that calcium hydroxyapatite it's a good product, and I think that everyone has to be comfortable with the product that it has, but in his hands. I make you an example. I'm a fan of hyaluronic acid since years, and I've never been surprised by unwilled expectations. But sometimes when I feel that I have to get better result, I go with the Genifil DX. I mean, we are not talking about that, but one of the products that are in the portfolio of bioscience is the DX, that is hyaluronic acid plus the dextranomer, and that gives a more long-lasting result with, I have to tell you, according to my experience and even to experience of Piero that has been using it much more than me, we are very enthusiastic about that. So I think that there are many products that can be used. Everyone has his specificity. And I really think that when you're comfortable with one product and you have good results with one product, you have to stay with one product.
And again, I'm connecting all the dots. And what about the combination of the products? We can talk even about neurotoxin, of course.
Yes, if we talk about combination of hyaluronic acid, I say yes, but in different layers. It means that if I have to correct the deeper surface, I go with G prime, with a specific G prime product. And if I have to correct, for example, the surface, because I just need, for example, the texture, I would never use a product that is super cross-linked or with big particles. So always in different layers. And combining, I think that everyone combines the use of different products, HA, botulinum toxin, and sometimes even energies. Even if about energies, we have always to be quite careful. I've seen quite recently a patient that she was treated by a very good professional here in Milano with hyaluronic acid, and then she was not satisfied enough. So she went to another one and he did radio frequency. And the result was unfavorable, because we know that if you add radio frequency to HA, you say bye-bye to HA. So we have just to be careful about the energies and the energies that we are using.
One more question, two more questions for you. One is, can you inject with a 34 gauge needle the lips?
So lips is one of the most malleable product that I never had in my mind, in my hands. It means that if you change the needle, and the syringe is very well done, I mean that the Luer lock system is very good. It means that you can put a 34 gauge needle and you press, and then the product goes out. But there is a but. You change a lot the rheological properties of the product. It means that you change it, and if you change so much the rheological properties, you will change even the durability of the product. So you can do it, but you will have a less long-lasting product. And we know that in lips, the major problem that we are facing always is the durability of the product.
100%.
So
100%.
we have to find a balance. This product is fantastic, is malleable, but it is super soft. If you reduce the durability,
then the patient complains. We know how it works.
We are working on eggs.
Yes. Thank you very much, Max. So I have two questions for myself from the audience, of course. The first one is what to do to avoid migration of filler in the calves, filler injection or HA injection of calves. Well, I would say not only for the calves, I believe I can talk also on behalf of Piero and Massimiliano, that whenever we inject the filler, as Massimiliano said, the filler is a rheology. Filler is made for a determinate layer. So the migration of the filler is something happening when we don't inject in the proper way. When we inject in the wrong layer, when we inject too attached to the muscle, so the contraction of the muscle can push the filler away. When accidentally we inject a subfascial, the filler can slide down and can migrate. We had cases of filler injected on the flexural hip dips with migration on the groin area, because the injection wasn't accurate at all, and the practitioner didn't have the sensibility of the depth where the injection was done. So to avoid this, my suggestion is, first of all, do the training. This is a very important thing. Be sure you are in the right layer. Ultrasound are helping a lot because you see immediately if you are on the top of the muscle or if you are below. So my answer is what to avoid: make your hand, make your experience, and inject slowly. Most important, do not go with very fast and very rough movement of the cannula. And the other question I got is, what would you do to automatic loss of fat in one leg after surgical debridement years ago? Do you advise HA filler or fat transfer? I'm a plastic surgeon. I believe Piero and Max, they will agree with me. If we have the possibility of fat injection, it's always the first option. So if we have enough fat to do a lipofilling, if the patient, I believe, has the intention of doing a surgery to remove the fat and do the lipofilling, in my opinion, it's always the first choice. Do you agree, Piero? Do you agree, Max?
Absolutely, yes. And in fact, I show the cases in which it was not possible to inject fat at all.
Totally agree.
Yeah, thank you. And also, after a fat injection, 1 month and 2 months after, we can still do a correction with the filler. The opposite is getting a bit tricky. So I believe we reached the end. Thank you, Dr. Crabai. Thank you, Dr. Brambilla. The other question will be answered by email from all of us, of course. I would like to say once again, thank you to all the audience for following us, and of course to Bioscience to give us the opportunity to do this webinar. And please feel free to contact us, feel free to ask whatever you want. We can be more than happy to answer your question, and we are looking forward to see you soon for next webinar and next conference. Thank you very much to everyone. Bye-bye.